We want to take a few minutes and welcome all of you to the celebration today. We are so grateful that you are here with us to see this vision come to a reality. I'd like to begin by sharing who I am. My name is Donetta G. Weiler, and I'm the current Vice President for Women's Services at Community Health Network. And I never knew when I took this role what a blessing it would be to be able to impact so many around us. We're glad that you're here, and we're so thrilled that you can celebrate this exciting day with us. This has been a long adventure. I will tell you, it's the longest pregnancy we've ever had. When we started planning this 3 years ago, I never knew all the moving pieces that we would have to adjust to get to where we're at today, but we're finally here, and I feel honored that you're here to celebrate with us. Before we go further, I want to make sure that we recognize the day that we're here to celebrate this wonderful day. Today's Veterans Day, a day when we should honor and show respect to those that have served in our armed forces. Here to share a brief reflection is a Community Health Network clinician, our clinical nurse specialist, who's also a colonel, and Colonel Diane Doty. Do you want to come up and share with us?
I am so proud to be a community nurse and a veteran. As a flight nurse for the Air Force, I have moved a lot of wounded warriors, and some of them we moved back to Germany just so their family could say one last goodbye. So on Veterans Day, please let us honor those of us who gave some, but more importantly, those of them who gave all. Thank you.
Thank you, Diane. I'll remind you of this later, but she'll be back on stage, and it's something you don't want to miss. We love to hear her talk. So we're pleased to have a lot of friends of community here in the audience tonight. Today, I want to make sure to call a few of them out. First of all, State Representative Carrie Hamilton. Also, Indiana State Representative and Chairwoman of the Legislators' Public Health Committee, Cindy Kirchhofer. Cindy, I want to thank you. I will tell you, the state has been so helpful in so many things, and without our state leaders, we wouldn't be here and in many other places, so we appreciate them taking the time to be here with us today. I'd also like to thank our CEO, Brian Mills. He's wandering around. Of course, he's letting us be on the stage today, but his great leadership also helps us get here. Jason Farlander, our Chief Operating Officer, who has been a great support. He's always behind women's health, and we're appreciative of that. And then our community board members and our foundation board members. Without their support, again, we wouldn't be here today, so we appreciate it. You know, lastly, again, I just want to take a minute to say that we're grateful for everybody that's on the stage that's going to talk today. And the next woman she is a voice for women's health. She is our leader of the Community North Hospital. She's the president of the region, and she's always there to listen to us when we need something. She supports our patients and supports our physicians and supports our staff. So without further ado, Kathy Cruzy.
Thank you, Donetta, and welcome to Community. I can tell you that it has been an absolute thrill to watch this project come to fruition. The Community Women's Center really represents a far-reaching collaboration involving so many dedicated people, but with one single vision, and that vision is to make women's health care services easier to access and navigate. Our organization was founded more than 60 years ago by members of the community who really wanted to make it easier to connect with healthcare services. Ever since then, we've maintained that commitment to the community that brought us to life and to the idea that healthcare services should be easy to access. Here on our North Campus, you can really look in all directions and see concrete examples of that commitment and that vision. Community Hospital North opened 3 decades ago now to help women, men, and children of the growing Northeast Side connect with the healthcare services that they needed. We surrounded this hospital with convenient provider offices, clinics, labs, imaging services, and outpatient surgery. We opened a heart hospital just on the other side of the garage there to provide world-class cardiovascular care to women and men, and heart disease is the #1 killer of women. We partnered to launch a rehabilitation hospital to help women, men, and children return to health and mobility following devastating injuries and illnesses. And most recently, just across the street, we opened a brand new cancer center to raise the bar on cancer care that's available to women, men, and families across central Indiana. Today, we add yet another way for women to connect to our care, the Community Women's Center. Our aim was to put under one roof all the various kinds of services that the women in our community might need, making it easier to fit your health into your busy schedule and ensuring the most convenient, connected, and collaborative care. Thank you so much for being here, and enjoy your day.
Thank you, Kathy. So this next introduction I'm real excited about. I get to introduce our new Indiana State Health Commissioner. Dr. Christina Box recently took a vital role in our state after our health commissioner at the time took a great role in Washington to be the Surgeon General. Many of you might know that Dr. Box also has a pretty long history with us at Community. She's a friend, she's a doctor, she's a supporter. She's been part of Community since 1987, and we are determined she's still part of Community, which is why she's here today. Without Dr. Box and without her guidance and her support throughout this entire process, we would not be here today. Again, she's that voice of reason. She's that voice that continues to remind us what we're here doing. And so I feel honored to welcome our new Indiana State Health Commissioner, Dr. Christina Box.
Thanks, Danetta. I just cannot tell you, I echo Kathy's words. This is a thrill to be here, to see this Women's Center up and functioning and running the way it is, to see so many of my colleagues and partners in this Women's Center out there today supporting this, and all of the other people supporting us within the community. This really is a realization of our dream of multidisciplinary women's care, all focused in one area. And I want to make sure that you know it's not about the building, although the building is beautiful, and I hope everybody takes the time to take a tour of it. It's really about the people inside that building. It's about the services that we put inside that building. And it's about keeping the patient at the center of those services. And that's why I've been so proud to be a part of community hospitals for so long. As Kathy and Danetta have shared, this is a vision of a community women's center to consolidate into one place a dozen different women's services. And I'm talking cardiology and endocrinology and interventional radiology and OBGYNs and breast surgeons, breast radiologists. We're talking our urogynecologist that is there. So everything from the spectrum of A to Z that we think that women might need, we've tried to put into this building. The goal has been to coordinate these services and to try to make more convenient and easy access for our patients, and do this across multiple disciplines. As women and caregivers, you know how difficult it is and how time-consuming it can be to take care of your own health. Making it to different appointments, getting to the necessary tests and imaging, following through with the recommendations and the treatments that have been given to you take a lot of time, and it's challenging when we're busy women in this day and age. And if you're like me, you've probably rescheduled your mammogram, your dental appointment, your colonoscopy a number of times. And what we're trying to do is, by putting this all in one place and coordinating it, we're trying to improve the idea that you as a woman will follow through with those important health care needs that you have. Because number one, we know that you lead health care for your family. We know that if you're taking good care of your health, you're going to be taking good care of your family's health also. But even more important than the ease of scheduling and the ability to coordinate those appointments, it's really about collaboration. It's about collaboration amongst our different doctors and our different specialties, such as our dietitians, our genetic counselors, our behavioral health experts, and physical therapy. All of this allows us to address a woman in a holistic fashion, therefore addressing the whole of the person and improving her health. The concepts of easy access and better collaboration are vital across the state of Indiana, too, and I carry those with me as I go forward as the new State Health Commissioner. Opening door to easier access for our patients is one of my priorities. In Indiana, we have the talent and we have the will, but sometimes we don't have the easy access for other patients throughout the state to get that. So my idea is to coordinate that, and if we can do that, I think we can address those major health issues that we have, such as infant mortality and our drug epidemic in this state. This is going to take organized efforts, not just from hospitals and their providers, but from state and local governments, from businesses across our communities, and faith-based groups. And I think it really starts at the grassroots community level, which again is something that's always made me very proud of community, because they believe in serving the people of their community. I want you to know that it's an honor to be trusted with the health of the people of Indiana and to try to improve that. But I am so very proud of what Community Hospital Network has done with women's care in their community to move that forward. Thank you.
Thank you so much, Dr. Box, and thank you for stepping up, and we're so proud of you. Congratulations on your new role as State Health Commissioner. And next, I'd like to introduce Cindy Kirchhofer. She is Indiana State Representative and Chairwoman of the Legislature's Public Health Committee, and has been such a good friend as we work to advance the health and health care for our community. So, Cindy?
Good morning, everyone. I'd like to thank you for inviting me to join in this wonderful celebration with you today and the opening of the Community Health Women's Center. First, I'd like to thank you, Colonel Doty, for your sacrifices and what you've given up for us and for our country. Thank you. It is an honor to be here today with Dr. Box and Kathy Kruse to recognize the tremendous work that's being done in this asset in your Women's Center. As we work together to address public health challenges in our state, it's no secret that there is much more work to be done. With that being said, what brings me hope is that we have invested, we have planned, and we are now on the path to improving health for all Hoosiers in this state. As healthcare providers continue to innovate in the field of women's health through new state-of-the-art facilities, just as this one, my colleagues and I in the General Assembly are committed to pursuing legislation to foster continued healthcare innovations, improvement of the delivery of and access to healthcare, and resources to our most challenging women's health needs, such as infant mortality, neonatal abstinence syndrome, and mental health needs. A couple of pieces of legislation in 2017 stand out in my mind as evidence of our new collective commitment to health and wellness and the progress we can expect in the coming months and years. First, we enacted legislation to further reduce Indiana's mortality rate from cervical cancer through awareness, education, and by requiring the State Department of Health to develop a strategic plan by December 31st, 2018. Cervical cancer is certainly an issue in this state. There are over 250 new cases each year and 82 deaths. For a disease that is largely 100% preventable, these numbers are too high. I look forward to working with Dr. Box and the State Department of Health on the path to treatment and ultimately preventing cervical cancer in Indiana. Second, House Enrolled Act 1337 expanded access to telemedicine services in rural and underserved areas by removing prohibitive and unnecessary Medicaid distance requirements. By removing these restrictions, Hoosier women who live in the most remote portions of the state can now harness promising new technologies to access primary and specialty care through telemedicine services. Last, but definitely not the least, the General Assembly passed a series of pilot programs meant to provide relief for Hoosier women in regard to the most serious health problem we face today, the current opioid epidemic. Senate Enrolled Act 243 incentivizes physicians who serve pregnant mothers to participate in medication-assisted treatment programs and training. With more providers trained in these life-saving techniques, we will help fill provider shortfalls and ensure those struggling with addiction get the evidence-based treatment they so well need and deserve. Greater access to addiction treatment for women will help bolster single-parent households throughout our state, as well as address and help prevent neonatal abstinence syndrome, a tragedy afflicting far too many newborns across the state and country. That legislation also created the Maternal Neonatal Opioid Addiction Project within Indiana's Department of Mental Health and Addiction to direct funding to innovative neonatal abstinence syndrome treatment programs. Finally, Senate Enrolled Act 446 created a pilot program specifically for pregnant women and mothers of newborns. We are dedicating funding for facilities that provide residential care for addicted mothers during pregnancy, delivery, and during the postpartum phase. These full-spectrum settings will help ensure that both mothers and their newborns receive proper treatment. These legislative initiatives are just one piece of the puzzle. I look forward to continuing to work with Dr. Box, the State Department of Health, Community Health Network, and other healthcare providers in improving the health and wellness of all Hoosier women. Thank you for having me here.
Thank you very much. We appreciate your attendance today. So we're grateful for the support and the efforts to make it easier for women to be healthy. Like I said before, our time downtown has been remarkable, and the support that we've gotten from our state leaders. So speak up, let them hear you. They're there to listen. So today we talked about this center being designed for women, and it truly is. As I mentioned in several interviews we've had, we listened to women. We listened to what they wanted. Many times there were things that we had left out, and we heard the women say, that's not a women's center. If you don't have this, it's not there. And so we changed the plans, we rerouted, and we made it what they wanted. So what better way to hear about the care that's offered by listening to a patient? So we've asked that one of our wonderful patients, Ms. Christy Davis, who is a Community North patient and been with us many times, you will soon hear, join to share her story. Christy?
Thank you, Danetta. Good morning. I am excited to be here today to celebrate the opening of the Community Women's Center. I have had 7 babies here, all at Community North, and my kids range in age from 14 years down to 5 months. And this place is filled with such sweet memories of me meeting my babies for the first time. And so I really can speak to the quality of care that patients receive here. So I would like to take a few moments to share some of my experiences with you. But before I do that, I probably should answer some of the questions that you might have that we hear all the time. Yes, my husband and I had all these babies together. And no, we were not trying to form our own sports team. Yes, we're busy. And thank you, we do actually know how this all happens. We do get lots of questions, and I don't think I was fully prepared for all of the attention having a big family would bring us. But as their mom, I don't see my kids as a big group, usually, but I see them as unique and individual, just as my pregnancies and deliveries were with them. Some of my pregnancies were easier than others, and some had complications. Some babies arrived on their own, and some needed a little help getting here. We've had babies from 4.5 pounds all the way up to 9.5 pounds. And one baby even arrived after I had spent the day as a bridesmaid. So through all of those different situations, there was one thing that was consistent, and that was the truly exceptional care that I received and the dedicated people who provided it. I found the care to be very skilled and personal and caring and attentive. And it was that attentive care that mattered so much when I developed a complication that was life-threatening with baby number 6. And he's the cutie little redhead up here. I had placenta previa, and while I was at home on bed rest, I began having some serious issues and was transported to the hospital via ambulance. And on the way here, the medic asked me if I was in medicine because of the information I was sharing and the questions I was asking. And I'm not, but I think that shows how well my doctor had prepared me and how I knew exactly what to do. So no time was wasted making decisions, and knowing what to do brought some calm to a very serious situation. So when I arrived at the hospital, the doctor on call was ready and waiting for me. And though my situation had somewhat stabilized by then, a few hours later, my condition worsened and Graham had to be born immediately. And minutes mattered. And so thanks to my attentive nurse and the skilled doctor and the quick response of the many who worked so well together, our lives were saved that night. And Graham was born at 31 weeks, so he spent a little over 6 weeks at the amazing NICU here. And though he needed a lot of help those first few days, today he is happy and healthy, and he is really excelling at his 2-year-old boy skills. Graham has brought us so much joy in our family, and except for being the best daily reminder to appreciate and be grateful for this life that God has given our family, you would never know he was a preemie. We could not have asked for a better outcome, and we are forever grateful for those who cared for us. So when I found out I was expecting again, I did have a lot of concerns and fears, and I received excellent support from caregivers here. And when we found out I didn't have Previa again, there was a lot of celebrating. Our sweet baby Gabe arrived this past June, and having had so many babies here, there really are a lot of familiar faces. So there was a lot of laughter in the OR that morning when I seemed to know everybody that walked into the room. And after the difficulty and the trauma of all that we went through with Graham, there was a lot of healing up that needed to happen for me and for my family. And Gabe's birth redeemed so much for us. So his arrival was such a joyous day, and I was so happy to be experiencing it with caregivers, many of whom have become dear friends, who knew me well and were so happy right along with us. I could not have imagined having my babies anywhere else. And there are many other stories that I could share and examples that I could tell of, there's my crew up there, that I could share of how well I have been cared for through the years. But I will finish with one last thought. This new space is beautiful and convenient, but it is really the caregivers that will fill it up that will matter most to their patients. And it's those people who I have come to know as some of the very best that will make this Community Women's Center an exceptional place.
Thank you for sharing your story, Christy, and being part of our community family. It really means a lot, and we are a family, so we appreciate it. So before we cut the ribbon, there's a few things that I want to share. First of all, I don't want to walk away from this stage without thanking a few people, a few groups that have been so important to really bringing this to a reality, because what Christy said really speaks to my heart, that we can have a building all day long and it can be gorgeous and we can spend as much money as we want making it look great, but without the people in the building, it's just a building. And it took a lot to get here. And so, I want to thank our AV crew who have dealt with us up and down the past few months to make sure we're ready. Our marketing team who have ran around and made sure we looked good when people needed us. And a very special person, Laura Earhart, who has been here from the beginning, making sure we stay on task because we had a deadline that we needed to meet. If you want organization, give Laura a call. And, to Jenny Byers, one of our managers, who has really taken on a lot in this center to make sure it's ready today. So thank you to all of our staff that's really brought this dream to reality. Lastly, I just want to tell you how grateful I am to have been in collaboration with so many amazing people. We're really raising the bar right now for women's health care, and it means the world to me. I have lost two very important women in my life, my mother and my grandmother. And I want to be here for my kids who are here today. And so take care of yourself. That's what this center is about. This center is about you. And if you don't think about yourself, who's going to take care of them when the day's over? So without further ado, we'd like to cut the ribbon and let you be here for part of that celebration.